Example, I didn't get the whole please go see your dentist. It was diagnosis, then straight into treatment.
Okay.
And then I had to get my tooth removed. During, exactly. Okay. I think this was maybe a few weeks after chemotherapy, just before my radiation. And the dentist she was worried. She was like, you have to watch out for dry socket, I think it's called, and stuff like that. So what are some of the tips that you can give us should I find myself in a situation where I need to get my tooth extracted?
Yeah, so we try and avoid extractions as much as we can.
I'm a gangster, right? Because
yeah, like I can take it.
Yeah.
Yeah, so we try and avoid extractions in general, but in chemotherapy or radiotherapy patients, there are complications.
Okay.
In chemo, it can the chemo is quite intense, so it wipes out your immune system.
Yeah.
So we want to make sure that you are not at risk of infection when we extract your tooth. Okay. If you're at risk if there is a risk of infection, or if infection does start, it's not going to heal. It's going to be extremely uncomfortable. Yeah. So that's for the chemo. For radiotherapy really messes with the bone density, the nerve, the blood supply in the bone as well. So if we remove a tooth, again, with limited blood supply, it may not heal the way it's supposed to.
Okay. Yeah. All right. Okay.
Yeah. So it will take ages to heal, or it won't heal, and we're constantly in pain. Infection, all of these things start to happen.
Okay.
Yeah. So those are things that we try to avoid. Yeah. How to do that? Like you said, in some instances you get the diagnosis and you're starting treatment immediately.
Yeah.
I think that is something that we probably need to work on because it doesn't. Some people are out of reach of a dentist, or they just don't know.
Yeah.
It is something that the health care workers in any department or at any stage in that chemo or the radiotherapy tray, everyone needs to be conscious of trying to avoid any sort of dental complications.
Okay.
Yeah.
All right. I hear that, and thank you for saying that's something you need to work on. Please tell your peers about it.
This video will help.
I hope so. Okay, so there are different types of cancers, right, that come with different types of treatment. For example, the cancer that I was diagnosed with was HER2 positive, which meant I had to go on Herceptin, which is like an immunotherapy. And there's HER2 negative. All these treatments are said to affect the teeth in different way. Is there a particular reason why hormonal treatment affects the teeth?
Yeah, so hormonal treatment largely will affect the supporting structures of the teeth. So that's your bone and your gums.
Okay.
Yeah, so your tooth is not just floating, right? It's sitting in the bone, and then the bone is covered by the gums. So any sort of hormonal therapy is going to be your gums are going to be very responsive to those things.
All right.
So that's where you find like bleeding gums is a common thing. You can get little swellings on your gums. You can get a sensation as if your teeth are getting loose.
Yeah.
All of these things, which without the treatment we would be terming, gum disease or periodontal disease. Yeah, so a lot of the time once hormonal treatment stops, these things sort of normalize as well. It may take some time because your body would have adapted to all of the hormones, but they generally
should subside.
They settle down. Yeah.
All right, speaking of these things settling, I have a couple of questions that I have from maybe 3 questions from some patients who I reached out to when I was going to have a conversation with you.
Okay.
The first one says, I'm 8 years post-treatment and my teeth still crack, especially when I stop using Sensodyne Repair and Protect. My teeth start getting holes that I can feel under my tongue. And just, because I think we spoke about this last time, she said she has been seeing her dentist, but the dentist isn't giving her a solution.
Okay. Yeah, so 8 years post-treatment, that's quite a long time. And it's good for her that she has found something that works for her.
Okay.
But not everyone has access to Sensodyne.
Yeah.
There's a cost implication as well because, it's quite a premium brand and all of that. A lot of the time, some things may have started during treatment. So, for example, with the way she's describing the cracking teeth, it sounds like there may be an element of maybe grinding or clenching or some of these things that can start when you're in a very stressful period. The holes that she could feel on the under her tongue. I mean, those a little bit specific. Those are things I would need to see.
Okay.
Yeah, I would need to see and try to understand what's going on. But
all right.
A lot of the time, a lot of these things do have solutions.
Okay.
Yeah,
all right.
A lot of these things do have solutions. It's just probably a collaborative way of trying to make someone as comfortable as possible.
Okay.
Sensitivity can last, a lifetime. There are people who just say, my teeth are sensitive, and that's it. But they just haven't been able to get that problem fixed. But it can be fixed.
Okay, all right. Yeah, because the last time I remember you said that a lot of things that happen in the mouth are fixable.
Yeah, a lot of things are fixable.
Yeah, okay, which is good, because a lot of us think that I have to stay with this for life. When you go through treatment, a lot of times when you go back to the doctor, they're like, that's part of treatment, that's part of it. Yeah. So you end up being so hesitant to get certain things addressed, thinking it's just part of treatment. Another question that I have here is, my teeth started troubling me during treatment, and they still do. They often randomly feel hard and sensitive on the one side.
Okay. Yeah, so I guess depending on which treatment she was on, whether it was the chemo or the radio, feeling hard, it sounds like it could be a bone, a bone or gum. She's feeling something. I mean, we can't ignore how she's describing it.
Yeah, okay.
But it would be up to us to figure out why she's feeling that.
Okay.
But that seems quite specific to type of treatment that she may have received.
Okay.
If it's a bone issue, then we're probably thinking of the radiotherapy. She had radiotherapy.
She probably did have radiotherapy.
Yeah, she had radiotherapy. She's probably feeling something in that area. There may have been pre-existing gum disease, which throughout the treatment, things just got worse.
Okay.
But yeah, it would be important to actually get consulted.
Okay. And then see what to do there. All right. And then the last one is, if my teeth have been discolored by treatment, is it safe to bleach them, and what's the best product to use?
Okay. First of all, any sort of bleaching or whitening, I would recommend that is done by a dental.
So I'm not just walking into Clicks Discum and getting my
stuff. Yeah.
Right.
If you do that, at least go and take it to someone, an oral health practitioner, who can actually be like, don't.
Okay. All right.
Go ahead. But I would recommend it's done by a dental practitioner.
Okay.
Some of these treatments it's common for your teeth to change. You lose that luster. It can get a little bit of a matte color or like a grayish color. Yeah, those things happen with treatment.
Okay.
Whitening may not be the best option. You may not get the desired outcome, because some of these stains or intrinsic stains may be so deep that the chemical agent that we use may not be able to wipe it out as best as we anticipate or expect.
All right.
So that means there's other things. There's composite bonding that can just give the tooth a better aesthetic. There's veneers, there's crowns. Again, it's one of those situations where she would need to express her specific concerns, what she wants to change about her teeth, and then the options will be presented to her.
Okay, cool. And then back to me.
Yeah.
All right. So I fell so much during treatment that I chipped my tooth once, and then another time when I was eating maputi, I chipped my tooth again, and now my teeth just look. There's 2 teeth that are chipped. And then they also kind of look a little weird. How do I deal with that?
You're in the right place. As we finish this interview. Okay. But like we said before, things are fixable.
Okay, yeah.
It's just a matter of identifying what the problem is and then seeing what your expectations are.
Okay.
And then we can have a very candid conversation of what's possible and what's not.
Okay.
And I feel like that's maybe probably even through radio, chemo, or hormonal treatment, expectations may not be explained very well at the beginning, and what to expect. So there's things that can be done.
Okay.
We can.
You heard it first from the doc. When you see me next time, my teeth will be all right. No, thank you so much for taking the time out, but there's also one specific thing that I wanted us to discuss.
Okay.
How important is it for someone to disclose before they come to you, and why is it important before you do treatment for someone to disclose that they've been through cancer treatment? Is that something that we should do, watch out for? What do you think about that?
Yeah, medical history is always important, because it shapes the symptoms, the presenting complaint that you're coming with, and also it will affect the treatment that we're going to prescribe.
Okay.
So something like radiotherapy, for example, if you need an extraction, I mean, we can go as far as saying we don't want to extract a tooth 12 months after radiotherapy.
Okay.
Because the bone really needs time to heal.
Okay.
So if you present at a dental clinic and then the dentist isn't aware of that and just extracts the tooth, or you didn't feel comfortable disclosing to the dentist for whatever reason, the healing won't happen as planned, and the immediate assumption is, the dentist has done something wrong. Yeah. So there's ways of protecting both the patient who wants to be assisted, and the dentist who needs to know how best they can assist. Okay. So yeah, medical history 100% is important. It really has an effect on what the prescribed treatment is going to be.
Okay, all right, awesome. Thank you so much for highlighting that. We see a lot of people are very shy to disclose this, so it's important when you reinforce why we should do it.
Sorry.
Yes.
What would be the reasons why, like for example, why someone wouldn't want to disclose that?
I think the first thing that I can think of is stigma. There seems to be a lot of stigma around cancers, particularly breast and cervical cancer, also with prostate cancer, so it seems. So people are hesitant to be known as the person who had cancer for whatever reason, whether it's they think huroi or whatever their beliefs are. But also I think there is cancer, something, the treatment is so invasive, it feels so personal. Like you don't want anyone else to be in your business, so you try to close that space off, and for other people it's just forgetting that this ever happened in my life.
Okay.
So yeah.
That's very valid.
Yeah.
Okay.
All right.
Oh, great. Thank you.
Thank you so much, Dr. Taku, for taking the time to speak to us. I'm sure that was so beneficial to so many survivors out there. Please